Welcome to the Dr. JJ Thomas Podcast.
Okay, let's talk about what happens in our body in terms of muscle activity in a healthy individual. It's somebody who doesn't have back pain, right? So there's tons of research that we have and we can refer to that looks at the behavior of healthy spines, well, really muscles in healthy spines, versus behaviors of muscles or lack of behavior in muscles of people with back pain. I've cited two here. One is from Spine Journal, Paul Hodges, and another one is from the Archives of Physical Medicine. But there's tons and tons of research on muscle activation using EMG analysis that shows us these things. We're going to review it right now. One of the first things it shows us is when they look at, now you guys have a baseline from the anatomy we just reviewed, right? So I'll try to be, dynamic so you can know what muscles I'm talking about if the names themselves aren't familiar. But when researchers look at what muscles are active when we bend forward, and particularly when we get to our end range of flexion, they found a couple things that was really interesting related to people with back pain versus people without back pain. One of the things they found is that at the very end range, the erector spinae muscles in healthy individuals, those without back pain, the erector spinae muscles, these sort of sexy tubular big fat muscles back here that I told you how important they are, at the end range of bending forward, they shouldn't be active. They actually should not be on, because in healthy individuals without low back pain, there's almost no activity there. Why would that be? The reason that is because in healthy individuals, those multifidi muscles, remember the really deep ones that traverse 4 segments and they scaffold all the way up to the C2 level of the spine, those muscles are critical, as I said, in the functioning of the disc, moving, kind of getting out of the way so the back can bend and extend, and just compressing the spinal at each segment and collectively at multiple segments so that our spine can nice and smoothly and easily bend forward. So very interesting, those erector spinae muscles, as I said, they're important, but in forward bending, maybe not, but in forward bending, if people are really active in them, it's probably a compensation mechanism for multifidi that are not doing their job instead. So something to consider there. Another really interesting thing, remember how we talked about how big and beautiful those glute max were, right? That's because they serve a really important purpose in the low back, in protecting our low back. And we know that from the research because when we look at healthy individuals and we measure gluteal activation, now it's not just glute max, they also measure glute med and min, which are, as I said, are super important. What they found is that in healthy individuals, the glute max in particular was active through the entire range. So all the way as they go down and all the way as they get up. Have you ever been in a situation where your back gets thrown out and you're like, you can't like sit, you feel like you're like, what is happening? You can't sit smoothly. You're like, oh my God, right? You're like that, or you're sitting for a long period and when you go to get up, you're like, oh, and you can't get that. That's what glute max does for you. So many people think I threw my back out, and 100% your back is not functioning well when you go to get up and you're like, ugh. But oftentimes people have to look at their glute max for that, because in people with low back pain, the glute max was not active as it should have been. So glute max are really important. We're going to incorporate them in our exercises that I'm going to teach you in a little bit. What else does the research say? This is the stuff that that stuff is pretty cool. There's some even cooler stuff though. Because when researchers look at what happens in the core, in particular, in relationship to either an anticipation of movement in the upper extremity, perturbation they call it. So either somebody's gonna jostle my arm, or I'm gonna have to catch something, or I'm gonna think about moving this arm. Even in anticipation of movement, they found transverse abdominis activation, that's that corset muscle. They found internal oblique activation. They found multifidi activation. And they found erector spinae activation as well. That makes sense because we talked about how this, right? That's in healthy individuals. Now, what's even cooler is when they study people who are in a state of low back pain, guess what? Those muscles not only do they not fire in anticipation of the motion, they fire late. So that correlates directly to what we were talking about with this forward bend and erector spinae compensating for this poor multifidi activation. Remember how I said anatomically transverse abdominis and multifidi, so transverse abdominis is the corset muscle, multifidi are those deep, deep scaffolding muscles. They're connected fascially, and they're connected to the pelvis via the thoracolumbar fascia as well. So it makes sense that when those guys all turn on together in anticipation of either an upper extremity motion or a trunk motion, that our spine can move free and our spine is not going to get kind of cogwheeled up and irritated. That also has positive effects on our joints, right? If our spine is moving effectively with great intrinsic stability, then we're not going to have these compensation patterns and our joints will have nice, healthy, clean, nourished motion. So that's a lot of what the research says, is if we can focus on exercises that will intrinsically stabilize all those really important players, transverse abdominis, multifidi, erector spinae, glute max, they're probably like some of the four. Oh, internal and external obliques are also on there, by the way. That anticipatory motion and external obliques, internal obliques as well had to fire. Think about this. One test you can do at home, which I actually meant to tell you earlier, but I didn't. Stand next to a wall and have your arm at like 90 degrees, like you're gonna contract your rotator cuff. And then I want you to place your hand against the corner of the wall or the door frame or whatever it is, or if you have a nice solid structure here, and then just press this arm into the door frame. When you do that, I also want you to feel your opposite obliques and abdominal muscles contract, right? These are your stabilizers, right? So this is that side body stability. All through rotator cuff, right? It's that same anticipatory contraction that I was just telling you we found in the research. And in addition, you can do the same thing with your glutes. Put your hand on your glute muscles, press, you'll feel them fire. Because if they don't fire, then my whole body's gonna move. So it has a stabilization effect that's really important for keeping our bodies healthy. There's one more piece of research I need to give you before we go to the exercises, because this piece of research ties all of this information together in a way that has value for you as someone who wants to escape the data in terms of trying to be that 20% instead of the 80% of people that will experience back pain at some time in your life. What this research is, it's by Angela Hibbs, 2008, Journal of Sports Medicine, and what she did was she did a very comprehensive literature review on what elements of a successful rehab or strengthening exercise program are critical for helping someone have a full range of stability through their core, okay? And what she found, the most resounding theme, is that people have to be training their core in all three planes of motion. So we talked about posterior chain, anterior chain, and side body. Essentially, all three planes of motion are frontal plane, sagittal plane, and transverse plane. So it's flexion extension, it's rotation, it's side bending, and variations of all of these motions are exactly what we need in order to have a comprehensive program that's going to keep you resilient and robust and strong and moving active and staying healthy throughout your life. So I've come up with my top 8 exercises for you. These are some of the most prescribed exercises we give here at Primal. Our patients do really well with them, and I think if you do them, you'll feel really good too. So let's get into it. All right, we're ready to go through these exercises. 8 exercises. You can break them up however you want. Just try to get them in throughout your week. You could do 2 of these exercises 4 days a week and get your 8 in. The purpose is following what that study said, which is training our body through all planes of motion in order to produce a very resilient, robust, strong spine. Okay? So the first one, we call this, it's a 3 months posture because, as you know, primal refers to like foundational, and it stems off of developmental kinesiology, meaning how we originally first learned to move is a great hallmark for us to attempt to restore our proper movement patterns. So 3 months posture is essentially something like this. In terms of setting up your arm here, the elbow should be in the front to back plane. It should be like kind of in line with your shoulder, okay? And then eyes are gonna be between your pointer fingers here. The reason that's important is because of what we talked about anatomically, how those erector spinae muscles essentially go all the way from our tailbone up to the base of our neck. If you actually look at the NIH recommendations for babies and when they should start tummy time, they actually recommend babies start tummy time literally 1 or 2 days after coming home from the hospital. Now I know, my oldest is 19. I know that I did not do that. I had no idea that they should have done that young at that time. But it kind of goes to show you how important those erector spinae are for our whole body's functioning. So, fingers spread, and we're right here. And to start this exercise, gaze is right between my pointer fingers, and I'm gonna push the floor away to get that serratus anterior locked in so it can anchor the abdominals for the next motion, which is gonna be head steady, and then keeping my shoulder blades locked, just slide one knee towards my elbow, just like that. Then I'm gonna go to the other side, and then I'm gonna go to the other side, all the while continuing to push my arms away, which really I'm pushing the floor away to stabilize my scapula, my shoulder core, as it anchors my spine and my rib cage for my abdominals to work on top of it. This is really the basic here. If this feels easy for you, which I'd be surprised, you can add a head control. So you slide one knee up, look at the knee, don't let the shoulder cave. Then come back, slide the other knee up, look at the knee, don't let the shoulder cave. So without the compensation, it would just be like this and like this. That's number 1. I'm gonna face you guys for number 2 so you can kind of get an idea of the angle here. So for number 2, it's also in that 3 months posture. This one is gonna train more of the posterior chain and those rotational strategies. So getting into that transverse plane for rotational patterns. So instead of being more rounded in the sternum here like we did for the first one, this one we're gonna be a little bit more stacked in with the elbows. From here, I'm also not pushing the floor away the same. I'm kind of actually settling into my rib cage here. Because we're gonna focus on more the rotational plane, I'm gonna have you shift onto one side. Maybe I will go slightly offset here. I'm gonna have you shift onto one side, take this arm and reach across your body on the diagonal. Then you're gonna push down through this arm and rotate and kind of draw. I always say like draw the sun. So you're pushing down through the base arm, looking and drawing the sun. Now most of you will not have this range, so don't kill yourselves. I always, whenever I give you exercises, I would like you to go to meet yourself where you are, okay? So if this is all you can do, that's great. That's what I want you to do, because even with just this, you're strengthening those spinal erectors, you're strengthening your stability muscles on your side body, you're strengthening your shoulder blades on the base arm, you're stretching your abdominal muscles as you reach around. You're getting a lot of really great activity here, and it's functional, and it's gonna translate into a healthy spine. So looking at it kind of put together, we're gonna shift, reach, and then draw the sun. Come back, shift, reach, draw the sun, and shift, reach, draw the sun. All right, exercise number 3. You're gonna need a band. I'm gonna give regressions of this because the first variation I'm gonna give you is fairly challenging, but I wanna make sure that I reach our wide range of audience here. You're gonna step into the band, have it secured to either, you may not have a gymnastics ladder at your disposal, but you can always tie a knot in the end of it and close it on a very strong, firm door. So you're gonna want the band to be at your hip level, and then you're gonna put yourself in quadruped, or essentially tabletop, because your knees will be floating. So you'll be in this tabletop position. Again, the band is pulling my hips that way. Tabletop position, opposite arm and leg are gonna walk sideways. And then I'm gonna go to the other side. Like So right arm, left leg, left arm, right leg, like that. And now this is controlling all those muscles we talked about that should be activating before we decide to bend or extend or reach or rotate, right? This is training those muscles to stabilize dynamically. As I said, that's a pretty challenging one. If that's too challenging for you, you can do the same thing in like a quadruped position. Get some good tension on it, and maybe go opposite arm and leg, something like that. Or you can just hold this quadruped position and fight the pull that the band wants you to do. Just keep your belly midline. Belly should be in the belly button, should be the same level as your nose. Sternum, nose, belly button, essentially. So to hold it would just be like this. And then of course you would want to do both sides though. So walk one direction, walk the other direction. That's exercise number 3. Exercise number 4 is booty makers. I told you how important the booty was, right? Here's the proof. So booty makers, again, we're connecting the upper trunk to the lower trunk. We're gonna be on our elbows in an elbow plank position. Fingers spread always, because that gives more input to the brain so that we can call in this information when we need it. So here we are in an elbow plank position, belly lifted, tail tucked, so not here, but here. We're gonna step to the side, keeping a stable spine. Now, almost everyone does this. Make sure your heel stays vertical. Now, if you really wanna get the most out of this one, I'm gonna show you an advancement. You're gonna go up, belly button tucked, side, heel vertical, reach up, over, back, and then back. Side, up, over, back, and back. I'll give you another view. Here, side, heels vertical, up, over, out, back, side, up, over, out, back. That's it. We're on to exercise number 5. Perfect timing because it's a static stretch, kind of. This is the Frogger stretch. You guys have probably seen me do this one before. It's definitely a fan favorite. Frogger stretch, it's gonna stretch those adductors. Remember, the adductors have a common attachment to the abdominals, all the abdominals. When the adductors are tight, the abdominals can't do their job. So we gotta keep these babies loose, and unfortunately, if you've seen any of my episodes on how sitting in chairs are killing us, literally, you know, when we sit a lot, our adductors get tight. So if you have a desk job, well, soccer players have tight adductors, lacrosse players have tight adductors, lots of people have tight adductors, runners. So you probably need to stretch these. Here we go. You're gonna start on your hands and knees, and then you're gonna walk, have your knees at like 90 degrees. So knees stacked under hips, and then you're gonna walk your knees and your shins out as far as you can get them. Keeping your toes flexed towards your nose and trying to make sure that your shins are perpendicular, your tibia, your shin, is perpendicular to your femur. So if you're here, you're not gonna get the most out of this stretch. You really need to be at like 90 degrees here. From there, drop down to your elbows, and then use your arms, again, integrating upper trunk to lower trunk for this functional muscle patterning, pushing back, and then breathe. So I said it's sort of static because it's a static adductor stretch, but by breathing, we're expanding the rib cage, which is stretching our abdominals above it. So it's dynamic through the breath. So for this one, I want you to hold 5 long, deep breaths. And that will be 1 rep. So 5 long, deep breaths, wiggling out anytime you need to get the most out of that stretch. That was number 5. Number 6. So we have to train in all 3 planes of motion, right? And we have to train rotation, and we have to also train anti-rotation. So if we're gonna train in all 3 planes of motion, this next exercise is gonna be a good one for that. You're gonna start on your butt like this. You're gonna start kind of leaning back like you're chilling, getting ready to watch a show. Now, this one's it might take you some time to get. Don't be frustrated with yourself, just work with it. You're gonna shift onto one side and raise one arm. I'm actually probably gonna have you just drop one leg because it's easier. It'll be easier for you to learn it this way. So you'll sit like this to start. From there, you're gonna push down through your base leg and your base arm, and you're gonna bring this knee to where this butt was. So you're gonna push down and then bring that knee right under the hip where that butt was, reach up, come back down, bring it back down. Now in an ideal world, we're an animal that is, we rotate, we anti-rotate and we rotate. We have asymmetrical patterning when we walk and we run. So in an ideal world, we're gonna switch right to the other side. You can drop this leg down, this arm is up, you're gonna press down through your base leg and your base arm, and then you're gonna bring this knee to where this butt was, boom, knee is directly under the hip, reach up, come back down, go to the other side. Here we are again, boom, reach, down, back, flip it, boom, reach, back, flip it. Now, without starting in that sort of like kickstand position, you can just go from here, boom, reach, down, here, boom, reach, down. So that's how, that's a little bit more of an advanced way. The regression of both of those, if those are too intimidating for you, I wanna make sure you have something you can do. You can shift to one side, these are crab toe touches, push down through base leg and base arm and try to touch your knee, or try to touch your shin, or try to touch your foot. Then drop down, switch sides, touch your knee, or touch your shin, or touch your foot, whichever progression you can do well. So boom, boom. Some people can't even lift up, and that's okay. If you can't lift up, what I want you to do is walk, I'll show you this way, walk this hand out and just touch real fast. Shift, walk the other hand out, touch real fast, all right? Those are the regressions. They're really important because as we walk and run and we try to propel ourselves forward, we need those anti-rotation muscles, side body muscles, to stabilize us. All right, exercise number 7, Copenhagen planks. They're so important. Remember how we talked about how important those adductors are, right? Side body stability, and we need to integrate the shoulders because the shoulder core is so important. I'll show you the first one. You can use an ottoman, you can use a bed, you can use a coffee table, something sturdy, and we'll talk about modifications if this is too tender on your foot or your knee or whatever. So from here, you're gonna lift up and try to get your nose, chin, sternum, belly button in line. This is a pretty hard progression though with that other leg lifted. So I wanna give you some other regressions. You can also, if that's too hard, you can bring your whole knee on. Now this leg will have to get out of the way for some people. So you can have it flexed up like this, that's okay. And what you're gonna do is press up and try to hold that like that. So that's a Copenhagen side plank. If that's still too hard, you can do it with this leg down, but just make sure that this guy's doing some of the work and you can periodically try to lift this leg just to make that adductor and midline stability pattern work a little bit better for you. All right, the final exercise, our body bag drags. As I said, I'm giving you exercises that are gonna make your spine resilient and integrate your core from head to toe, especially linking the upper trunk to the lower trunk. So body bag drags, they're a pulling shoulder core. So you'll be in like an elbow plank position and belly lifted, tail tucked. You're gonna shift, reach, pull, shift, reach, pull, shift, reach, pull, just like this. Now, if that's too hard for you, wait, I'll just give you a recommendation. Hardwood is great with like a pillowcase or something, or if you don't have a hardwood option, you can do it on carpet with like paper plates or a game box upside down or sliders or whatever you have. If the body bag drag on your elbows is too hard for you, you can also just drag your whole body on the floor. So it looks more like this. These are kind of more of a lat focused body bag pull. So you're here, grab the floor. You kind of need some skin, like I'm gonna grab the floor and pull your body like this. Pull your body. You can see how that looks like a lat pull down essentially, right? So it's like a only I'm grounded to the floor. My spinal erectors are active like I want them to be, like tummy time, like our, like developmentally, like in developmental kinesiology, we learn to move that way. Spinal erectors are active, lats are tying into the spine and pelvis, core is engaging as I pull forward. It's a really great exercise. Give it a try. That's it, guys, those 8. So 8 sounds like a lot, but as I said, if you break it up into, I always, when I work with patients, try to always make it manageable and achievable for you guys. So the way I recommend doing this is just go in that order, but pick 4 days a week where you're gonna do it consistently, take 2 per day, set a timer for 1 minute for each exercise, so that's 2 minutes out of your day to give yourself a strong, resilient, healthy spine and prevent low back pain. And that's it, super simple. Please tag me with any questions, shoot me a message and DM me on Instagram, or if you have any questions, just shoot me a comment. I'm happy to answer your specific questions as best I can, but give it a shot, give me a shout out, and stay tuned for more tips.